Hmm. Assalamu alaikum. Uh, can anyone please tell me if you can see the screen or not? And is my voice audible and clear? Okay, great. So, Assalamu alaikum. Welcome to the Journal Club. And in this session, I will be explaining to you a research which was conducted, and there was a comparative analysis of two drugs, which is basically we can say in a layman, they are both are the blood thinners, and they both are given in a disease which is known as atrial fibrillation. We will talk about that, and it will later. Just a minute. Can you still see the screen, or is this just 1 minute? I think the screen is okay. Okay. So we will later discuss that which drug is better, warfarin or apixaban. So let's start. So before going into depth of the two drugs, first we will discuss about what is basically is the chronic kidney disease, because ultimately why we are not using one of the drug which will fail because of this disease, which is basically the side effect, which is chronic kidney disease. So let's discuss what is chronic kidney disease first. So chronic kidney disease, which is abbreviated as CKD, is a progressive condition where the kidney do not function properly over the time, and it can be caused by different factors. One of them, which is the highly risk factor, is the diabetes, then the hypertension, and the kidney infections, and other factors, which will obviously is a drug intake. So these are the conditions which can cause the CKDs, and they are characterized on the base of the function from mild to the severe. They are categorized in the 5 stages, from stage 1, which is the mild form, and the stage 5, which is the severe form. And the severe form, the transplantation and the dialysis, both are the treatments, which is curative one, the transplant, and the management is the dialysis. Anyways, so early CKDs may not have any symptoms, but as it worsens, symptoms can be swelling, fatigue, and the change in the urination. CKD can lead to some diseases, which is high blood pressure, anemic problem, and the bone problems may also be there, and there is high risk of this cardiovascular diseases. So this is about the chronic kidney diseases. It's a very progressive disease, and as the name indicates, it's chronic disease. So it is not occur in the first time. It is basically due to a progressive loss and deterioration of the kidney cells and the damage to their function. Now we'll discuss what is the second thing, the atrial fibrillation, because this disease we are talking about is the reason why we are using these two blood thinners. So first we have to discuss what's the physiology. So the atrial fibrillation is basically a condition of the heart where the heart upper chamber, like the atria, beats irregular and too fast. So there is too fast beating and irregular beating. So what's the if the blood if the heart is pumping too fast, then one might think that the fast blood can increase the blood flow, and the blood flow to the organs may increase, but this is not the case here, because if you see the physiology of the heart, so first the atrias are filled with the blood, and after the filling there is a diastolic phase, which is basically filling phase. And when the atrias are completely filled, then the contraction of the atria causes the blood to go into the ventricles and then to the body. But here what is happening in the atrial fibrillation, the the heart does not have enough time to be filled, so ultimately it results in the low blood flow. It disrupts the normal heart rhythm and can lead to the blood clots, stroke, and the heart-related problem. So because of this formation of the blood clots, we are giving the blood thinners, the warfarin and amixaban. So we will discuss that which one is better. Atrial fibrillation symptoms include what are the symptoms? That's palpitations and fatigue, shortness of breath, dizziness. These are the some symptoms you can see in a patient, and it affects around 2% of the general population, but its prevalence is much high in individual with certain conditions, because if the person is already suffering from the CVDs, and he is might at risk, and he is more prone to to develop this atrial fibrillation. So atrial fibrillation, what it causes, it increases the risk for the stroke, heart failure, and other complications may be there. So it's the disease we are trying to manage here. So we are managing the both this disease of with the drugs, which is known as the blood thinner drugs. So let's discuss that this research is about which one is better, amixaban or warfarin. So let's discuss the fight between the amixaban and warfarin, who will win. So both are basically uh, have enough benefits, and but in one of them have adverse effect. So why we are not using one of them is because of the adverse effect, which is obviously we have discussed that it's the CKDs. So let's discuss. Okay, this is the difference between amixaban and the warfarin mechanism of action. So before going into depth, we can also have insight, which is not in this research, but I have added this because we should know that amixaban and warfarin, what mechanism of action they have. Amixaban is basically a direct inhibitor of factor 10A. So factor 10A, which is the clotting factor, it's a direct inhibitor, whereas the warfarin disrupt the synthesis of vitamin K dependent clotting factors. So vitamin K dependent clotting factors are being the all factors are being disrupt because of this warfarin, but the amixaban only works specifically on the factor 10A. This is the mechanism of action of both. So we can say that amixaban has more specific and more targeted action, unlike the warfarin, which is inhibiting the whole clotting cascade. The amixaban is working on a single factor. Yes, warfarin action is broader, affecting multiple vitamin K dependent factors involved in the clotting. Due to its targeted action, amixaban generally has more predictable anticoagulant effect and require less frequent monitoring. So you also have discussed about the INR, which is the basically done when the patient is on the warfarin. So he requires frequent monitoring because his vitals may drop anytime. So by after advising and infusing the warfarin, the patient should be monitored frequently, and unless he might be in danger. But by using the amixaban, the one advantage is because it is very targeted and specific, it only acts upon the on some factors, and because of that, sorry, because of that, it has less side effects and does not require frequent monitoring. Okay, so about the study design, let's discuss about. Now all the slides I have prepared is only from the research, so I will be discussing all the stats and all. So I have summarized all the slides in these few slides you are going to see now. So what about the study design? The study known as the amixaban for reduction in. So Aristotle is basically not a name. It's basically abbreviated form of the amixaban for reduction in the stroke and other thromboembolic events in the atrial fibrillation. Both can be abbreviated as a term, which is Aristotle trial. So Aristotle is basically this abbreviation. It was a research effect to compare the effectiveness of the two medication. You only know that the two medications are amixaban and the warfarin in the patient with the atrial fibrillation who were at risk at stroke. I have already discussed that if a patient is suffering from atrial fibrillation, he is risk of increased number of clots and may lead to the stroke because the clots can dislodge and go to the brain and can cause a stroke. So the trial was conducted between 2006 and 2010, and it involved around 18,000 people, 18,000 patients from 39 countries, and patients were randomly assigned to either apixaban or warfarin, and this study lasts for a median of 1.8 years. So this is the basic overview about the research. Let's discuss about the relationship between the chronic kidney disease. Okay, and atrial fibrillation. So more than 30 million Americans which having the chronic kidney disease it has been found by taking all the data, and the chronic kidney disease patient have a high risk of having the heart problem. This is basically the points I have added from the statistical data which they have concluded before the research, because this is not the research. Our research is on the medication. So this is the data they have shown before the research, that about the 30 millions Americans have the chronic kidney disease, and this have a high risk of having heart problems, including the atrial fibrillation. And atrial fibrillation is a heart condition, and its prevalence is low in the general population. The CKD patient has over 10 times higher risk of the atrial fibrillation, especially those with severe CKDs. This is the statistical data which they have given to us. So the AF and the CKD impact on the health. So what are the impact a patient might suffer if they have this problem? So among moderate CKD patients, atrial fibrillation prevalence is about 20%. Advanced CKD patients, especially those on dialysis, can have up to one third prevalence of the total atrial fibrillation prevalence, and the hemodialysis patient have a higher risk of stroke and bleeding, with 1 in 4 experiencing a blood clot related annually. So this is a high risk. So why we are using the blood thinner? So safety of the blood thinner anticoagulants for the CKDs patient. So standard blood thinner warfarin may lead to bleeding, and we already know the mechanism of action now. So we know that since it is inhibiting all the coagulation cascade, because it is working on the vitamin K dependent clotting factors. So because of that, it has a higher risk of bleeding, and newer types may be have introduced, but they are more safer. But limited evidence of these anticoagulants safety for the advanced CKD patients. And they are approved for CKD patient with certain kidney functions level, because sometimes it is seen that someone's kidney function is not well. So that's why this anticoagulants are often not recommended. Unlike amexaban is one of the its type, and but it is used in CKD and needs more study. So it was before the research, and now we have the research, so we have the data now. So amexaban versus the warfarin study. So the study tested amexaban against the warfarin in the CKD patients with atrial fibrillation and mild kidney impairment, and the goal was to compare the safety and the effectiveness of the drug. So research also look at how amexaban behave in the body in this. So basically, you can now imagine you are in this era where there are many CKD patients, and uh, since they are having the atrial fibrillation now, so they have to be given the drugs which are the blood thinner. But infusing the warfarin may risk to more bleeding. So now you are about to test another drug, which is the amexaban, and so this is now the testing phase. Sampling. So how this sampling takes place, those patients are taken which have the atrial fibrillation or atrial flutter, along with at least they have one additional risk factor for the stroke. And they were the eligible group for the study. And the patient could also join if they had experienced at least 2 episodes of atrial flutter within the 12 months prior to the enrollment. So this is the criteria they have set, that there might be the patient which have the atrial fibrillation, or they have at least experienced 2 episodes of the atrial flutter within 12 months prior to the enrollment. However, certain conditions were excluded, such as what they are excluding is very high serum creatinine levels or severely reduced kidney function. These patients or the patient on dialysis were not part of the study. So they have uh, separated these patients which have atrial fibrillation plus these they are on dialysis or have a high serum creatinine level. So this is about the sampling. Now coming towards this research. So researchers use a method called the population pharmacokinetic analysis to study this. Sorry for that. So what is to better understand how the amexaban behave in the different situation, they conducted a complex study using a method called this the pharmacokinetic analysis, and they use a special software to combine the data using the Aristotle trial. So I have already told you that what is the Aristotle? It's the abbreviated form, and the software they are using is the non-linear mixed effect modeling. It's the kind of a test they are running. There's a statistical test, the non-MAM is they are running here. So the focus was on the patient with moderately kidney dysfunction and having the low creatinine serum creatinine level. So the study participant and the data. So in this study, it involved a 298 patient with 25 to 30 ml of the creatinine level out of the 18,000 participants they have taken from the Aristotle trial. Uh, Patients were given the amexaban or warfarin, uh, uh, and their outcome was observed. So about the safety and efficacy outcome, what are the outcomes now? So amixaban was found to reduce the major risk bleeding compared to the warfarin. They have noticed this thing, but they do not have a clue why it is happening. Similar trends were seen for the stroke or the cystic embolism, indicating the amixaban effectiveness in the maintaining the efficacy. So this is about all the introduction that how the research of the amixaban versus the warfarin is conducted. Now, there may be in the research, there might be some implications and some limitations. So about the implication, the study provides the insight into the amexaban behavior in the patient with reduced kidney function. So let me clear again, the patient have taken this are not completely having the kidney failure. They have a reduced kidney function plus the atrial fibrillation. It contributes to understanding the amexaban's safety and the efficacy in the individuals with the kidney problems. And it may offer benefits in reducing the risk of the bleeding, which was basically the flaw, which I can say, of the warfarin. A bleeding problem was there because it is important, but it is having a side effect which can be deadly. So this amexaban becomes a lifesaver and a promising option for the patient with this advanced kidney diseases. So about the limitations. So limitation is the study specifically focus on a specific group which does not have a severe kidney. We have already talked about that. More data are needed on the newer anticoagulants. They have in the research, they have said that there is a gap and we need more newer anticoagulant in the stage and more testing should be there. Data analysis was overseen by specific leads and the senior authors. Okay, so now comes towards why amexaban is used. So amexaban offers a very promising alternative to the warfarin. So let's discuss from the start that the first importance is amexaban is having is its mechanism of action, which is basically specific and targeted to the factor 10. Then amexaban is having when they are giving to the atrial fibrillation patient, they are showing less bleeding because of the its mechanism of action. So if we compare both the drugs now, we can easily saw the difference and we can easily say that the amexaban is a better option than warfarin because it reduces the risk of the bleeding and an essential factor in improving the patient outcomes. Okay, So the research is already ongoing, and several trials are currently underway to further explore that is the amexaben already safe, and if there is any other side effect which is unseen in this research but can be seen in 2 to 3 years after the research has been conducted. So this study will provide more insight into optimal treatment strategies of the patient having the atrial fibrillation. So let's conclude what in the research is the amexaben wins here, and amexaben stand out as a preferable anticoagulant option for the patient with a moderate kidney diseases, not a severe one, and it reduces the major risk bleeding while maintaining the efficacy in preventing the strokes. So, and the ongoing future researches will enhance our understanding of the mexaban benefits for the patients with advanced kidney disease and guide the treatment decision. So let me show you the reference article from where this research has been taken, and this is the reference article. And now you know that amixaban versus warfarin in the with the atrial fibrillation and the advanced chronic disease, who wins is amixaban for sure, and you know the reasons now. So this is all about what I have concluded from this research. I may miss some points, so you can also check out this article. Uh, now, anyone, if there any question. No, Dr. Madhia, they did not check the frequency because the amexaban was on a trial at the on the first trial, so that's why they did not check the recurrence. Any other questions? All right. Okay. So if there are any question, you can write in the comments later too. So I will answer that. So now I am ending this session. Thank you so much for coming and listening to the session. Allah Hafiz.